see a person on the ground and think that they might need some help. You've surveyed the scene and it's safe to approach. Shake their shoulders and ask, "Are you okay?" Point to someone and tell them to call 911 and bring the AED. The next step is to check the victim's ABCs. A stands for airway. Place one hand on the forehead and the other on their chin. Open the airway by performing a head tilt, chin lift maneuver. B stands for breathing. Place your head next to the victim's mouth while looking at their chest. You will look, listen, and feel for breathing. Look to see if their chest is rising. Listen for air coming out of their mouth and feel for air coming out of their mouth and hitting your cheek. C stands for circulation. Check for a pulse by placing 2 fingers on the carotid or radial artery. If the victim does not have a pulse, you will need to provide chest compressions. Remember the acronym CAB. C stands for compressions, A stands for airway, B stands for breathing. You want to provide compressions at a rate of 100 to 120 per minute. Open the airway and then provide 2 breaths. With the airway open, pinch the nose and place your mouth over their mouth, making sure that there is a tight seal and no air can escape. Provide 2 breaths into the victim. Breathe in until you see the chest wall rise. Let the air come out before providing the second breath. Perform 30 compressions and then 2 breaths. Repeat that cycle until more advanced care comes and takes over or the AED arrives. If you are providing chest compressions, that means that the victim's normal heart rhythm is malfunctioning and you need to restart it. This is done through the use of an automatic external defibrillator or AED. The diagram on the AED will tell you where to place the 2 pads on the victim's chest. Turn on the machine and make sure no one is touching the victim. The AED will analyze the heart rhythm and tell you what to do, whether it is to provide a shock or to continue chest compressions.